Various contraceptive methods, namely natural or traditional, barrier method, IUDs, oral contraceptives, injectables, implants, and surgical methods. Natural methods of contraception. Natural methods work on the principle of avoiding chances of ovum and sperms meeting. Periodic abstinence is one such method in which the couples avoid or abstain from coitus from day 10 to 17 of the menstrual cycle when ovulation could be expected. As chances of fertilization are very high during this period, it is called the fertile period. Therefore, by abstaining from coitus during this period, conception could be prevented. Withdrawal or Coitus Interruptus is another method in which the male partner withdraws his penis from the vagina just before ejaculation so as to avoid insemination. Lactational amenorrhea or absence of menstruation. In this method is based on the fact that ovulation and therefore the cycle do not occur during the period of intense lactation following parturition. Therefore, as long as the mother feeds the child fully, chances of conception are almost nil. However, this method has been reported to be effective only up to maximum period of 6 months following parturition. As no medicines or devices are used in these methods, side effects are almost nil. Chances of failure, though, of this method are also high. Barrier methods. Barrier methods, ovum and sperms are prevented from physically meeting with the help of barriers. Such methods are available for both males and females. Condoms are barriers made of thin rubber or latex sheath that are used to cover the penis in the male or vagina and cervix in the female just before coitus so that the ejaculated semen would not enter into the female reproductive tract. This can prevent conception. Nirodh is a popular brand of condom for the male. Use of condom has increased in recent years due to its additional benefit of protecting the user from contracting STIs and AIDS. Both the male and the female condoms are disposable, can be self-inserted and thereby gives privacy to the user. Diaphragms, cervical caps and walls are also barriers made of rubber that are inserted into the female reproductive tract to cover the cervix during coitus. They prevent conception by blocking the entry of sperms through the cervix. They are reusable. Spermicidal creams, jellies and foams are usually used along with these barriers to increase their contraceptive efficiency. Intrauterine devices. It is the most effective and popular method. These devices are inserted by doctors or expert nurses in the uterus through vagina. These intrauterine devices are presently available as the non-medicated IUDs. Example, Lippis loop, copper releasing IUDs, CUT, copper 7, multi-load 375 and the hormone releasing IUDs. Progestat LNG20. IUDs increase phagocytosis of sperms within the uterus and the copper ions released suppress sperm motility and the fertilizing capacity of sperms. The hormone releasing IUDs in addition make the uterus unsuitable for implantation and the cervix hostile to the sperms. IUDs are ideal contraceptives for the females who want to delay pregnancy. It is one of the most widely acceptable methods of contraception in India. Contraceptive pills. Oral administration of small doses of either progesterones or progesterone-estrogen combinations is another contraceptive method used by the females. They are used in the form of tablets and hence are popularly called the pills. Pills have to be taken daily for the period of 21 days, starting preferably within the first 5 days of menstrual cycle. After a gap of 7 days, it has to be repeated in the same pattern till the female desires to prevent conception. They inhibit ovulation and implantation as well as alter the quality of cervical mucus to prevent or retard entry of sperms. Pills are very effective with lesser side effects and are well accepted by the females. What is Sehili? Sehili, the new oral contraceptive for the females, contains a non-steroidal preparation. It is a once-a-week pill, the very few side effects and high contraceptive values. Injection form of contraceptives, progesterones alone or in combination with estrogen can also be used by females as injections or implants under the skin. Their mode of action is similar to that of pills and their effective periods are much longer. Emergency contraceptives. Administration of progesterones or progesterone estrogen combinations or IUDs within 72 hours of coitus have been found to be very effective as emergency contraceptives, as they could be used to avoid possible pregnancy due to rape or casual unprotected intercourse. Sterilization. Surgical methods are also called sterilization, are generally advised for the male or female partner as a terminal method to prevent any more pregnancies. Surgical intervention blocks gamete transport and thereby prevent conception. Sterilization procedure in the male is called vasectomy and that in the female called tubectomy. Vasectomy. In vasectomy, a small part of the vas deferens is removed or tied up through a small incision on the scrotum, whereas in tubectomy, a small part of the fallopian tube is removed or tied up through a small incision in the abdomen or through vagina. These techniques are highly effective, but their reversibility is very poor. MTP. Medical termination of pregnancy. Intentional or voluntary termination of pregnancy before full term is called medical termination of pregnancy or induced abortion. In India, Government of India legalized MTP in 1971. MTPs are considered relatively safe during the first trimester up to 12 weeks of pregnancy. Second trimester abortions are much more riskier. Why MTP? Obviously, the answer is to get rid of unwanted pregnancies either due to casual unprotected intercourse or failure of the contraceptive used during coitus or rapes. MTPs are also essential in certain cases where continuation of the pregnancy could be harmful or even fatal either to the mother or to the fetus or both. Sexually transmitted infections. STIs. Infections are diseases which are transmitted through sexual intercourse are collectively called sexually transmitted infections or venereal diseases or reproductive tract infections. Gonorrhea, syphilis, genital herpes, chlamydiasis, genital warts, trichomoniasis, hepatitis B, and of course the most discussed infection in the recent years, HIV leading to AIDS, are some of the common STIs. Sexually transmitted infections. Some of these infections like hepatitis B and HIV can also be transmitted by sharing of injection needles, surgical instruments with affected persons, transfusion of blood, or from an infected mother to the fetus too. Except for hepatitis B, genital herpes and HIV infections, other diseases are completely curable if detected early and treated properly. Early symptoms of most of these are minor and include itching, fluid discharge, slight pain, swellings in the genital region. Infected females may often be asymptomatic and hence may remain undetected for long. Absence or less significant symptoms in the early stages of infection and the social stigma attached to the STIs deter the infected persons from going for timely detection and proper treatment. How to avoid sexually transmitted infections? By following these 3 steps to avoid sexually transmitted infections. Number 1. Avoid sex with unknown partners or multiple partners. Always try to use condoms during coitus. In case of doubt, one should go to a qualified doctor for early detection and get complete treatment if diagnosed with infection. Infertility. A large number of couples all over the world, including India, are infertile. That is, they are unable to produce children in spite of unprotected sexual cohabitation. The reasons for this could be many: physical, congenital, disease, drugs, immunological, or even psychological. In India, often the female is blamed for the couple being childless, but more often than not, the problem lies in the male partner. Specialized healthcare units, infertility clinics could help in diagnosis and corrective treatment of some of these disorders and enable these couples to have children. However, where such corrections are not possible, the couples could be assisted to have children through certain special techniques commonly known as assisted reproductive technologies, ART. IVF, fertilization outside the body in almost similar conditions as that in the body. In vitro fertilization followed by embryo transfer is one of such methods. In this method, popularly known as test tube baby program, ova from the wife or donor and sperms from the husband or donor are collected and are induced to form zygote under stimulated conditions in the laboratory. The zygote or early embryos could then be transferred into the fallopian tube. ZIFT means zygote intrafallopian transfer and embryos with more than 8 blastomas into the uterus. IUT intrauterine transfer to complete its further development. Embryos formed by in vivo fertilization, fusion of gametes within the female, also could be used for such transfer to assist those females who cannot conceive. ZIFT Gamete intrafallopian transfer. Transfer of an ovum collected from a donor into the fallopian tube of another female who cannot produce one but can provide suitable environment for fertilization and further development is another method attempted. AI Artificial insemination technique. Infertility cases either due to inability of the male partner to inseminate the female or due to very low sperm counts in the ejaculates could be corrected by artificial insemination techniques. In this technique, the semen collected either from the husband or a healthy donor is artificially introduced either into the vagina or into the uterus. IUI Intrauterine insemination of the female.